We are going to get started with the Anne Arundel County House Delegation meeting. I'd like to start with Delegate Bartlett, who's going to lead us in the Pledge of Allegiance and the prayer.
Thank you, Mr. Chair. Please join me in honoring our country with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Now, if we'll have a moment of prayer. Dear God, thank you for all that you have bestowed upon us. Give us the strength, the wisdom, the intelligence, the compassion to do your will as we work to serve the constituents of Maryland, ours, and throughout the entire state. We appreciate all the blessings that you have given us, and we hope to do all that we can to honor you. Amen.
Amen.
Thank you, Delegate Bartlett. At this time, I'd like to take a moment to introduce special guests that we have on the call this morning. And I see Senator Bidle has joined us. I see the county executive who is here, and I'm going to allow the county executive to introduce his team. I also see Senator Elfreth has joined us. Thank you for joining us, Chair Elfreth. And that's all I see at this time. And if we have others that come on, we'll make sure that we acknowledge them. So with that, I'll turn it over to County Executive Pittman to acknowledge his team.
All right, we've got with us my Chief of Staff, Dr. Kay Bodgester Brown, our Chief Administrative Officer, Matt Power, our Legislative Director, Pete Barron, our Budget Officer, Chris Trumbauer, our Health Officer, Nilesh Kalyanaraman, and from the Office of Law, we have Ethan Hunt, and from our Budget Office, we have Hannah Dyer.
Thank you for that, County Executive, and to all of your team. Thank you for joining us this morning, and we look forward to hearing your presentation and remarks in just a few minutes. So the next thing on the agenda is a hearing for House Bill 95, Anne Arundel County Board of Education, meeting requirements, officers by Delegate Bagnall. Just an administrative note, as we call for any witnesses for a bill, they will have a maximum of 2 minutes to present their information. They have written testimony. Please provide that to Sienna to share with the delegation. The Education Subcommittee will review the bill. Then it will be put on the agenda for a vote from the entire delegation. A letter will then be sent to the Standing Committee with the results of the vote. So that's the process that we'll follow. I do understand that a piece of testimony came in late last night, probably around 8:30. So everyone may not have had a chance to review it, but just wanted to make you aware that we have received that. So that may be something that you want to look at after we have the hearing. So with that, I'll call on Delegate Bagnall.
Thank you, Mr. Chair. Good morning, my esteemed colleagues of Anne Arundel County. For the record, I'm Delegate Heather Bagnall, District 33, here on behalf of HB 95. You have my written testimony, so I'll try to quickly summarize. As this delegation is aware, over the past 3 years, we have been transitioning from a fully appointed to a now fully elected school board, and that transition has brought with it some growing pains. For 3 years, my office has been fielding concerns about meetings running well into the night, impacting not only board members, many of whom have children, jobs, and additional responsibilities, but also parents with school-age children, teachers who are trying to be engaged in our school board processes, as well as the Anne Arundel County staff who still have responsibilities beyond the school board meetings. We've all been in hearings which stretched our ability to focus, follow, be informed, and articulate. But even within the crushing workload of our 90-day session, we put some limits on length of testimony, on questions from members, on extemporizing beyond the scope of the agenda or issue at hand. Additionally, we have shared resources such as committee staff, office staff, and whole state agencies at our disposal. In January 2020, the school board engaged at significant expense the Gibson Group to conduct a performance audit. According to Anne Arundel County Public Schools 2018 to 2023 strategic plan, AACPS has a driving value to maximize the efficiency and effectiveness of its business practices. Well, it's 2022. And although we have made some very, very recent improvements, it is my firm belief we need to take some proactive action. So I propose 4 simple guidelines to address the issue. The bill stipulates that Anne Arundel County Board may not vote on any action after 10 p.m. The board must elect a parliamentarian at its annual meeting who is to advise the members on rules, procedures, and precedents. And the board must complete the public portion of every meeting within 6 hours. The legislation also allows for exceptions to some of these rules to maintain the members' ability to accomplish their important work to the community. The hearing in Ways and Means was January 20th. At the Board of Ed meeting January 19th to consider this bill and other legislative efforts, the board made a motion to oppose the bill. The debate and discussion on the motion took approximately 30 minutes of a 4-hour and 40-minute meeting. The board adjourned this meeting after tabling discussion on a policy which would have impacted teachers and students without a vote after extensive discussion. In reviewing the concerns raised by the board, I did feel the gray area around engaging county versus state legal resources, even as a resource, was a reasonable concern, and have offered an amendment to address it, pulled from the language of the Gibson report. This bill is modeled after a motion that failed to achieve 5 votes, the motion of which was also modeled on actions taken by other larger school jurisdictions. Additionally, although I would prefer not to interject the will of the General Assembly into our local school board, once again, this legislation is a final, not a first effort at a course correction. Education is the great equalizer, one of the strongest investments we make in the future of our children, our workforce, and our economy, and the work of our board is essential. Thank you for your consideration of this important local legislation, and I respectfully request the support of our delegation on House Bill 95.
Thank you for your testimony, Delegate Bagnall. And it's my understanding that we don't have any witnesses at this time. So I will open the floor for any questions for the bill sponsor. Delegate Chisholm.
Thank you, Mr. Chairman. Just one quick question, and thank you, Delegate Bagnall. Do you know what the vote total was? What was the vote count when they did take it to vote? Did you say?
On the opposition, it was 6-2.
6-2.
And in that meeting, and it was in public meeting. So if you want to review it, it's January 19th. The board did make a commitment to doing this, but a commitment isn't the same thing as an action.
Okay, thank you. I just want a clarification. I appreciate that.
Certainly.
Delegate Pina Melnick.
Yes, thank you for bringing this bill. And I'm sorry, I'm not on video at the moment. I'm not able to do it on my phone. But I just want to bring to the attention that there's a very compelling email that was sent to us last night, actually from Ms. Dawn Myers, which actually expresses her frustration as a parent and someone that has put in a lot of time to, in Prince George's County, in the community. And she's begging us to please do something about it, especially given, as the delegate stated, their meetings that have gone really very, very late, and people are not able to give feedback. And I want to ask the delegate, in all these years, can you sort of talk a little more about the frustrations that you have heard from the parents and some of our constituents? Because I know I have received some emails as well.
I've received a wide range of concerns, depending on what the agenda was. We had concerns where I had about 200 parents reach out to me when there was a change in policy that wasn't revealed around redistricting, where a new map was offered in the middle of a meeting that hadn't been public. It hadn't been available for public scrutiny. It was a change of the process. I actually spoke to it's okay to change the process, but you have to have a process to change the process. Meetings have extended well into the late hours. We've had votes at 1 in the morning, 2 in the morning. The parents are trying to follow and be engaged, and they're being asked to be engaged. And then we have unreasonable lengths of time for these meetings. We have some parents who have 2, 3, 4, school-age children who have also been trying to pivot during COVID to online learning and then back to in-person learning. And they simply can't keep up. They're overwhelmed with trying to follow these meetings.
Thank you.
Okay, so the chair recognizes in this order Delegate Bartlett, Delegate Lehman, and Delegate Jones. And just let me offer up again for those that might have joined in late, this bill will be going to the Education Subcommittee chaired by Delegate Jones. And so there will be time for this to be looked at a little bit further in case there are other questions by the subcommittee. So Delegate Bartlett.
Thank you, Mr. Chair. And thank you, Delegate Bagnall, for bringing this bill. This is a difficult bill. And I appreciate you having the courage to bring this one. And I say difficult because on the one hand, there have been efforts to, with the motion and everything, to try to do it internally. And it is important. This is a unique body because of the fact that we have school-age children and parents wanting to be involved. And I love the fact that parents want to be involved, which is always a good thing. We don't want to stifle their involvement in any way. Let me ask you about, you mentioned something in your testimony, or you alluded to larger school districts, that this has been done, or action has been taken in larger school districts. Can you just expand on that just briefly? I know Mr. Chair likes to keep it moving, so just briefly, if you may.
Certainly. That was actually flagged for me when the motion was made to pass this. One of the members, Dana Schalheim, had actually researched what other larger jurisdictions such as Los Angeles had done to address this issue, where they wanted to have public engagement, but their meetings were becoming unreasonable. So she actually said, I can share that information with you because she sent me the reports that she based her motion on.
Thank you. And I serve on the subcommittee, so I'll get that information. Thank you, Mr. Chair.
I'll get that to the subcommittee.
Thank you, Delegate Bartlett. Delegate, I think Lehman was next, and Delegate Jones.
Thank you, Mr. Chairman. And I want to echo Delegate Bartlett's words about the bill. Thank you for bringing it. It's not an easy topic. Delegate Bagnall, you and I were able to discuss it fairly extensively a few days ago, and I'm glad you brought it to my attention. And I certainly understand the need for these reforms. My question is there any exception language in there when the board, for example, is coming up on one of these cutoff times, whether it's the 10 o'clock, whether it's when they have to end altogether, or it's past the point where they can vote, but they're very close to the point of, maybe within a few minutes? Is there any way to make for someone to make a motion? Is there any build-in for exceptions to these rules if the case can be made and it's warranted?
Yes, thank you for the question. That actually is part of the bill, because we know that those cases happen, and sometimes you have to make decisions, in a meeting. Or continue the discussion or the debate. So they can vote to suspend the rules with a vote of 5, which is consistent with the vote requirement for passing any motion.
Thank you. Thank you, Mr. Chairman.
Thank you, Delegate Jones.
Thank you, Chairman. Thank you, Delegate Bagnall, for bringing this bill, which I too have received. It's an important discussion. I've received scores of emails and phone calls over the last year about the length and about folks who have children at home. They're trying to be, they're participating in their school board, and they have more than one job. So they need to be up early in the morning, or they're at work a second or third job at night. So for the record, how long are these meetings going?
So according to the Gibson audit, and thank you for that question, according to the Gibson audit, prior to 2018, meetings were averaging about 2 hours and 18 minutes. And that was including discussion and public comment. Meetings are now averaging about 5.5 hours with the efforts that the board has taken recently. So that 6-hour time limit is still within the average meeting, but we have outliers of 8 hours, 7 hours, 9 hours, and even 12 hours. So there is conversation to be had about whether that 6-hour limit is even the right place, but that felt like a reasonable compromise.
Thank you, Chairman.
Delegate Lehman, I see your hand still up. Is that okay? All right. So thank you, Delegate Bagnall, for the testimony. I will remind everyone that, again, this will go to the Education Subcommittee. And then I will also just sort of flag, for what it's worth, we will have actually the Board of Education they'll be coming before us next week. So we'll have the president of the board and the board members coming before the delegation next Friday. So with that, we'll move on to our remarks from our County Executive Pittman.
All right, thank you. I'm not muted, am I? No, I don't think so. Can you hear me?
Yes, you're
good.
Loud and clear.
Thank you. It's great to be with you, Chairman Rogers, Vice Chair Bagnall, and Senate Chair Elfreth, and all the members of the Anne Arundel County delegation. Wish we were in person, but once again, here we are, zooming away. So let me start just by saying that Anne Arundel County is strong. The financial condition of county government is more stable and resilient than it has ever been, with new reserves and tax rates that are lower than any other central Maryland county. Violent crime is on the decline, even while it's increasing across the region and the country. And we have contracts in place to relieve our worst traffic on the state roads that connect us. So wages are up, jobs are available, and opportunity is being expanded to more residents than ever. The county invested $32.8 million directly into our local businesses since the start of the pandemic through our own economic recovery grants, and 150 businesses opened new facilities in 2021. And within county government, you have an extraordinary team of public servants who have proven that they can and will deliver under extraordinary circumstances, not just for some of our residents, but for all. So before I highlight some of the challenges and the opportunities that your legislative work can impact this session, I'd like our health officer, Dr. Nilesh Kalyana-Raman, to give us a brief update on the topic that we all wish would go away, the COVID-19 pandemic. But before he does, I want to thank the good doctor for his extraordinary service to the people of Anne Arundel County. He does ask us to sacrifice, but he and his team have never shrunken back from their duty to protect the lives of the people of this county. And when the patient, the people of our county, refuse the prescribed treatment, Dr. K and his team stay by our side and do what they can to heal us. But I want to lay down a warning. The political attacks in an election year against the institutions that exist to protect our people will fail. Our county council came precariously close to rejecting over $5 million in state support for our health department's vaccinations, testing, and opioid interventions a few weeks ago. One more vote against accepting those funds would have had a crippling effect on public health. The frivolous lawsuit challenging the state law that has been used repeatedly across Maryland to save lives during this pandemic had no legal merit and did exactly what Dr. George Everly of Severna Park warned us against at the start of this pandemic when he said, division delays recovery. Our Department of Health has serious work to do, and I hope that you will support the governor's increased funding for local health departments in his budget. And with that, I'd like to give the floor to Dr. Kalyanaraman.
Thank you, Chairman Rogers, and thank you, County Executive. I'm happy to be before you today and to share where we are with COVID, and I think more importantly, where we're headed with COVID. Today, I'm really pleased to note that we're seeing strong recovery. Our hospitalizations are decreasing. We have repeatedly, as the course of COVID has moved, pushed more and more towards identifying hospitalizations as the key metric. And the reason for that is, well, COVID is and it has been and remains serious. We now have more tools to be able to both prevent and treat it. Vaccines are extremely effective, and we want people to be up to date on their vaccinations. That's the terminology we use now, because as we go along, we recognize that much with the flu vaccine, we need periodic boosters. And so our goal is to have our population remain up to date on their vaccinations. And obviously, there's still moving understanding of what up to date means, what's the timeline, but we will be on top of that. Just to give you a little bit of a picture on what up to date means, it means that if you've had your 2 shots and you're due for a booster, you get your booster. However, if you just got your 2 shots a month ago and you're not due for your booster, you are also up to date. So it really does have to do with the timing of your vaccination. In our county, 53 to 54% of people who are eligible for a booster have gotten it. We want to continue to push that number up because we're seeing that people who are not vaccinated are the most likely to get hospitalized from COVID. People who are vaccinated but not boosted are the second most likely. For those who are truly up to date on their vaccinations, the chances of hospitalization are very small and are typically tied to chronic severe health conditions. Vaccines are a key part of how we're doing better. Our hospitalizations entered crisis standards of care, which means that they cannot provide the usual standard of care to the people coming because of the surge in COVID cases that was due to the Omicron spike. We had up until about a month and a half ago, had avoided seeing our hospitals buckle under the pressure of COVID surge. And yet in our county, where we have the second highest rate of vaccination, we have a robust vaccination, testing, and masking supports. We were still susceptible to that. And that is why that is a clear manifestation of why COVID is still so dangerous, because we can do everything that we need to do and it can still attack us. And the hardest thing to absorb is that if we don't do those things, it will be worse. And so what we're seeing now, excuse me, is that with that Omicron surge is fading here, it is continuing elsewhere in the country. As we're thinking about what comes next, we want to be prepared for the worst case scenario. But I want to lay out what we expect to see over the next 12 months. What we expect to see is that there will be another variant at some point. I do not know when. It could be in February, it could be in June, it could be in October. We don't know. But the pattern so far has been that there will be a variant. We don't know how severe it will be. We don't know how quickly it will transmit. We know none of those things. So what we need to do is be prepared. And I liken it to how folks in the Midwest are prepared for tornado season. You know there's going to be a tornado. You don't know when it's going to come. You don't know where it's going to hit. So you stay prepared. And when it comes, yes, it's bad, but you know what to do. You do it, and then you recover from it. And that's really what we're entering with COVID. It's not a, we want it to go away, or we must always stay in kind of our guard up. We're going to have to find a middle path, one that allows us to operate normally, but also recognize when the threat is increased and to respond appropriately. And so that's why we're really focusing on over the next 6 to 12 months, what we're going to do to be able to be prepared. Because the best case scenario is that COVID becomes a part of the cold and flu season, it is still severe. As we saw just now, it still causes a lot of illness, it still causes a lot of deaths. In the past 4 weeks, we had 109 deaths from COVID. That is a massive number of people who have lost their life to COVID, and scores more who were hospitalized. So we're going to be focusing on how do we stockpile masks and tests, continue to make them available, but truly to have them ready to go when we see an increase in cases, when people's demand increases, so that we can get them out. Vaccinations will continue to be a hallmark of what we do. And as we go along, we'll see greater and greater availability of vaccinations in doctors' offices. And that's really where we want to see that happen, because we want that to be a part of routine care. Oral medications are the next piece of that. So if you do get COVID and you do have high risk, oral medications, which are now approved, but really are not being used to their fullest potential yet. And that's largely due to supply limitations at the federal level. There just hasn't been enough medication produced yet, but that will grow, that will increase, it will be more readily available. And that's going to be an easier treatment option than monoclonal antibodies. Monoclonal antibodies, at least prior to Omicron, were more readily available, but an infusion that you need to do at special sites is logistically challenging. An oral medication that you can get at the pharmacy around the corner, a lot easier. Everybody is familiar with the idea of going to the pharmacy, going to a doctor, getting a prescription and filling it at the pharmacy. And so we're going to be really working on making sure that that becomes available and that people understand that if you're sick with COVID and you have certain high risk conditions, you should get that oral medication. That's going to keep people safer, and that's going to keep our hospitals better able to care for those truly who have the highest morbidity from COVID. And then, of course, making sure that equity is a part of this, and that has been a core of our response to COVID throughout, is making sure that we are getting prevention, early intervention, and treatment to those groups, communities that are not either not doing well or haven't had access to that. And so you can see that in our testing, our at-home test distribution, our mass distribution. We certainly make it available for the public, but we also want to make sure that we are targeting it towards those communities that have been hardest hit. It's why we're partnering with not just the libraries, but community organizations, faith-based organizations, nonprofits, food pantries, to get supplies out into communities that are hardest hit. And then lastly, I want to finish with saying that COVID will be with us. And as the county executive noted, the more we are able to come together to deal with it, to understand that people have different viewpoints on it, but collectively we are in this together, the more successful our response to it will be. Thank you, Chairman Rogers.
Thank you, Dr. Kalayana-Raman. County Executive, did you want to continue before we take questions?
Yeah, why don't we get through this and then we can do questions on both for both of us and questions to any of my other staff as well.
Okay, please continue.
Okay, all right. Well, first, thank you, Dr. K. I think we all appreciate your ability to look to the future and plan for the coming months and years of this pandemic, even in the midst of the deadliest month that we have had so far. But first, I want to look at some of the really amazing opportunities that the good work of this body and of county government have created for us going forward. First, I just want to say the fiscal condition of the county has probably never been better than it is right now. We think we have a good chance of improving our bond rating with the agency that has where we have a AA now to get to AAA. Some of that is due to increases in our rainy day fund that we've put money away for future bad economies. The fact that our taxes are lower than the rest of the region, so we're not capped on our income tax side, particularly the way most of Central Maryland is. Those are things that the rating agencies like. And the fact that we've gotten our infrastructure spending in hand. We've caught up with infrastructure spending, but our spending affordability, which was 76 million over before I took office in the last budget, is down to 0. And we're actually doing pay as you go for a lot of capital projects. So that all looks much better from a fiscal perspective going forward. But I do want to say that we don't have the kinds of surpluses that the state has right now. We have a lot of inflationary pressures in this budget. A lot of our employees are going to expect some pretty hefty cost of living increases due to inflation, and we don't have that kind of revenue coming in. So it's going to be a difficult budget year. So please don't do anything that cuts our revenues. Do what you need to do at the state level, but anything that is cut, we have to fill that gap either with revenues elsewhere or with cuts to services. So please keep that in mind and stay in touch with us as you think about that. I want to say something about traffic and transportation in particular. We did in that PPI, the Permanent Public Improvements Fund that we created the first year, set aside money to be able to incentivize work to provide a carrot to state highways to come in and address the worst traffic in our county on state roads. And in the past, we've relied on the state to completely fund those. What it did, that carrot approach, is it moved Anne Arundel County's projects up into the top 10 scoring projects. 6 of the top 10 scoring projects in the state now are Anne Arundel County. So you will see progress on Route 2, Route 3, Central Avenue, and many others. And as I took the reins, I became chair of the Baltimore Region Transportation Board just recently, and the opportunities right now, federal and state, but federal money in particular, are extraordinary, and we can make real progress by having shovel-ready projects, and so we look forward to that. And I do want to just put a footnote here. Please support the bill that Senator McCray and Delegate Anderson are putting forward to fully restore highway user revenue. It's the top MACO priority this year, and that money goes directly to repair and maintain the roads in our county. So I'm sure all of you are supportive of that. I want to note that we have increased substantially the funding in our county for public safety and for education. Our police department funding since 2018 has gone up 31%, more than any other county in the region. And as a result of that, and also the good work that all of our agencies have done, violent crime has actually dropped 11% in our county last year, while the rest of the country and the region have risen. The investments have gone to getting our firefighters, our police officers, and our teachers' pay up so that they're closer to the regional average, and increasing the numbers as well to meet national standards. And I want to note that teachers finally got that contract so that they're getting the money for back steps. It took us 3 years to make up those back steps that the teachers didn't get after the recession that they were promised. And I have heard a lot of stories of how that's impacting their families at a really difficult time to be teaching. We have a lot of work left to do there, but it's a major milestone for the teachers of Anne Arundel County. So thank you for everybody who's helping make that possible. I want to note that the blueprint is challenging. It's challenging to implement, but it is an excellent roadmap. And I think our team, the team at Anne Arundel County Public Schools, as well as our new Opportunity Gap Commission, is monitoring it closely, is really excited about the prospects, and is committed to moving forward. So we're your partners there on implementing the blueprint. Kindergarten readiness is something that I worry a lot about. A lot of us do. The numbers are not good, and we have a lot of work to do there. So one of the opportunities is getting pre-K available for all kids before they go into kindergarten. And I've talked to our economic development team. There's a lot of retail space that's vacant in our county that could be converted if we can connect these entrepreneurs to the space, provide the technical assistance to get these private pre-K operations going in our county. So we'll be working hard to implement that part of the blueprint as well. I want to note that one of the biggest challenges, not only for the private sector, but also for government is difficulty hiring, labor shortage. And that is inseparably linked in our county to affordable housing, transportation, and childcare. So just please keep those 3 things in mind as we move forward. And I want to note that for government, the labor challenges impact school bus drivers, we all know about, but teachers, childcare workers, engineers and planners, police, fire, and really all public service. So we have vacancies that we're working hard to fill, but that's been a challenge for the county as well. We are in the process of implementing the Police Accountability Act. We have had a series of meetings where we've gone through what the state requirements are and what we need to put in our Arundel County bill to implement the state requirements. And that needs to be all in place with the Police Accountability Board by July 1st. So we're working on that. We will have a council bill ready to go here in the coming days that will go through the public engagement process as well. And there is one challenge that I've talked to the leadership about, and I just want you to be aware of if there's a way to fix it, that while we can get our Police Accountability Board seated and ready to go by July 1st, there's work that the state has not done yet with the Maryland Police Training and Standards Commission on the discipline matrix and training for the charging committees that will actually take cases. And so there's this window of time where there's no way that the charging committees will be ready to hear cases on July 1st. And so there may need to be a legislative fix to deal with that window. We don't want officers waiting with no system to be able to address their cases, or people who filed complaints having no system to address their cases. So look forward to maybe a fix on that. There's one local bill that I want to note that will be introduced by Senator Elfreth and Delegate Rogers, where we're going to need your support. The county provides a property tax exemption for our disabled vets and their spouses. State law does not allow us to offer that exemption through our special taxing districts. So we want to change that, and this bill will give us the authority to do that. So I hope we will have all of your support on that. And then second to last, two more things. Second to last is parks. I want to thank you for the $9 million last year that from the local Parks and Playgrounds Infrastructure Fund. I heard at Budget Town Hall just last night, we're in the midst of that process in all 7 districts. Somebody gave us some statistics that showed that Anne Arundel County spends 25% less per capita on parks than the national average, parks and recreation. And it's an important investment. It's an investment in health, wellness, and in our environment. So I want to tell you just where that money went last year, and that we are ready to get more if you can come up with more. It's almost we can take as much as you can provide. The Bachman Sports Complex, Quiet Waters Playground, Quiet Waters Park Planning and Renovation, Overlook Park Dog Park, Odenton Park improvements, Deal Community Park, Beverly Triton Park Development, South Shore Trail, and Fort Smallwood all received significant installments of funding from that $9 million. So thank you, thank you, thank you. And then finally, this is last, and this is big, so bear with me, not long, but it's big, is Crownsville. So when the state of Maryland closed Crownsville in 2004, Crownsville Hospital Center we're talking about here, it was left to deteriorate. It is an eyesore. It's a 544-acre toxic eyesore in the geographic center of our county. So former governors and county executives knew that something needed to be done, but they failed to agree on a plan. And that changed when I took office. Governor Hogan invited me in for a meeting to discuss ways that we could work together. And I said we needed to address Crownsville. And I shared the vision that our residents and many of you have talked about for years. And we agreed at that meeting that the solution was for the ownership of the property to transfer to the county. And unfortunately, we needed to wait for yet another study from the state to confirm their desire to surplus the property. We finally got the green light to proceed last September, talked to the governor again, deal was on. So we're moving forward. The question you might ask is why is our county willing to take on what is really the state's liability? Why bail the state out? Why not sue them for leaving over 50 vacant buildings, underground toxic infrastructure, crumbling roads, and 544 acres of beautiful land in the heart of our county? And I guess the answer is just we're better than that. And it's the only way to move forward in a way that we control the destiny. So we trust that the state of Maryland will work with us. We trust that every delegate and every senator from both political parties appreciates the fact that we have at that site 4 addiction treatment and mental health crisis programs whose clients are mostly from other counties. We trust that our friends from outside our county recognize that the legacy of Crownsville is a Maryland legacy and that the future of Crownsville is a state opportunity. So Crownsville Hospital Memorial Park will absolutely serve county residents, as will the nonprofit incubator that we envision, the veterans housing that we hope to create, and the health and wellness programming that will grow from the ashes of yesterday's approaches to mental health. We have the Crownsville Dream Team already preparing to take on the project. Our Chief Administrative Officer, Matt Power, just happens to be the guy who worked on plans for Crownsville in his former job at the state. Our Budget Officer, Chris Trumbauer, just happens to be the guy who led the last county task force on the future of Crownsville. Our friend Janice Hayes Williams is the conscience of Crownsville and has already been working with Senator Riley and Delegates Bagnell, Munoz, and Saab on funding for the Say My Name Memorial to be placed on land that the state will retain, where patients were buried in unmarked graves. My Chief of Staff, Kay Bodgester Brown, has convened nonprofits for the incubator. Our Director of Central Services, Christine Anderson, is transferring contracts for security and maintenance as we speak. Our Rec and Parks Director, Jessica Lays, is planning public access. And our Community Engagement and Constituent Services team is planning the community planning process. So we are all in to transform this neglected land, where a small group of heroes continues to serve the most vulnerable among us, into a place where the best of humanity is displayed, where healers gather in the presence of nature and restore health and wellness to all who visit. Governor Hogan has offered a first symbolic investment in this transformation of $2.5 million. Assessments, planning, remediation, and demolition of that which cannot be restored is where we must start. Just that, and making the property safe for public access, will cost upwards of $30 million. So that is our ask of the Maryland General Assembly. That is the investment that we seek from the state of Maryland as it transfers a liability and a responsibility to Anne Arundel County. We look forward to working with each of you from both political parties as we educate all members of both the House and the Senate about the history, the condition, and the opportunities that Crownsville Hospital Memorial Park offers. Healing transcends politics. Crownsville transcends politics. So let's get this done and get it done right. Thank you. Any questions?
All right. Comments? Thank you, County Executive. With that, we will entertain questions. We'll start with Delegate Chisholm.
Thank you, Mr. Chairman, and thank you, Mr. County Executive, and thank you, Dr. K. And Dr. K, I call you Dr. K with all due respect, just because no matter how many times I try to say your last name, I end up jumbling it up. And since the County Executive uses Dr. K, I'm assuming it's good with you, because I do appreciate what you do. I'm just, I'm fielding a lot of calls and emails every day on the confusion of where we are with the Anne Arundel County mandate. And I know when you implemented it on January 7th, you cited Health Code 18-208, and I think Section B, which says you need to have authorization from the Maryland Department of Health. And since I serve on health and government operations, it's safe to say that I'm in constant dialogue and communication with the Secretary or Assistant Secretary Webster Yee. And there's still confusion. I have a hard time telling my constituents on whether or not they gave you authorization. I know that they've told me several times they take no position, but I don't know if they've given an affirmative authorization. And if so, I'd like to ask, what role or support are they giving you in enforcing this mask mandate, if any at all?
So Delegate Chisholm, I think the best way to approach this is kind of to take us back before the mask mandate into how we generally operate with the Maryland Department of Health. So as a local health department, we have pretty broad latitude to put into place programs, policies that are going to improve, preserve, promote, and protect is what we talk about, the public health of the county. A lot of the decisions and discussions that we have are internal to the health department or are in line with standard guidelines, either promulgated by CDC or Maryland Department of Health. When there are times that we do discuss issues with the Maryland Department of Health, my contact is generally with the Deputy Secretary of Public Health. That is who I interface with most regularly. And I the way that those discussions typically occur is that it's not approval or denial. It's a discussion of issues. We work through, are there any other considerations that need to be made? And then ultimately that is my decision to make. We don't get explicit approval generally, nor explicit denial, frankly, unless it's an extreme case that requires that. Our discussions around the mask mandate followed that same template. I had discussions with the Deputy Secretary of Public Health prior to its institution. We discussed the landscape, everything that has been laid out so far, the issue, the crisis standards of care with the hospitals, the emergency declaration and catastrophic health emergency noted by the governor. But I think most importantly, the situation with our hospitals in terms of the large number of cases that they were seeing, what was happening in other counties, that there were mask mandates in place, and we've had them before as well. And in my conversations with the Deputy Secretary, she made it clear that this was my decision, and that while the health department wouldn't take a position on it, they were neither stopping it nor approving it. It was our decision to make. Now, along with that was also a discussion of the legal issues and the legal support for that. And that is a conversation that I had with, and I can't go too far into that, but I had with our county office of law and also with the assistant attorney generals at Maryland Department of Health. And so everything that we cited in that order, particularly statute 18208B, was done with the counsel of lawyers at both the county and the state level. I understand that there's a desire to know whether they approved or denied it, but that's not how we operate. That's not how we have historically operated, and that's not how we operated in this instance. And I think that's really important because in the context of that statute as well, 18208B, there isn't anywhere that it says that it has to be authorized or approved. It says cooperate, and that is how we operate always with the Maryland Department of Health. So it's not, I don't even see this instance as a different version of cooperation. We are always cooperating with them, and we are always working together, and there's always a push and pull on that.
So by that rationale and push and pull and cooperation, then you could take the position that you can implement something without the approval of the Maryland Department of Health, and which makes you could be the most powerful person in the state because you no longer need the state's approval or the Maryland Department of Health's approval or the health board in Anne Arundel County, which is the county council, because in this instance, they denied the majority vote. And if you're telling me you don't really need the authorization, you just need cooperation or dialogue, then theoretically in the future, and I'm not just talking about you, my concern, and I know my constituents' concern is, what about when Dr. K is gone and we have somebody else in there that maybe doesn't like feels like something else is an infectious disease? Because as you just pointed out, we're always going to have coronavirus or infectious disease. It's just part of world history. Hopefully we'll eradicate it someday, but it makes you the most powerful person in the state of Maryland at that point, or in Anne Arundel County above, based on what you just communicated.
I respectfully disagree, Delegate Chisholm. So I think let's be clear that when this action was taken, it was in consultation with the county executive. And I feel confident saying that I had his full backing on this. It was in consultation with the county council. And while you note that there was a vote, it was 4-3 in favor. That wasn't the supermajority required because it was an emergency ordinance. But I did actually contact every single county council, all 7 of them. And there was a majority support for this action. It was 4-3. I understand that's a nuance that is hard to kind of communicate through, all of the kind of machinations between what's an emergency legislation, what's routine, what's the Board of Health. But I did have the support of a majority of the county council.
And I understand. I appreciate that.
I'm not the most powerful person because I had the backing of the county executive, the county council, and I had MDH's understanding. I could not have moved forward without all 3 of those pieces being in place.
So
all right, Dr. Colorado, thank you for that response. The chair recognizes Delegate Bartlett, followed by Delegate Chisholm.
Thank you, Mr. Chair. My question is, actually not fully a question, but it's to our county exec. And that it pertains to what you said about Crownsville and some of the mistakes that were made there between the state and the county had to pick up, basically is picking up the duty there. I'd like to ask, please, that given that Waxter Children's Center in western part of the county, which has closed, it closed January 2022, and we've talked about this briefly, that it's not a Crownsville repeat, because that is a good sizable amount of land, and I know that our citizens in District 32 could benefit from very good use of all that land and all that property. And so I just wanted to put that bug in your ear one more time, and I'll continue to work with you, of course, that Waxter Children's Center closed January 2022, and we need to be on the lookout for proper treatment of that facility as well. Thanks.
Delegate Saab.
Thank you, Mr. Chairman, and thank you, Dr. K and County Executive. And I think this is probably our last official meeting and delegation of this term. So I'm sure we will be always having dialogue as we always have in the past. But the question that I have for County Executive, you mentioned inflation, and inflation is a scary thing, not just for government, but it's also scaring our citizens and the impact on our economic growth in this county and just in this country in general. And, obviously our tax on gas is tied to our CPI. So everything is increasing. If you go to the grocery store, you notice everything, maybe inflation is only 7%, but a lot of things are even higher. And it's just as devastating to county budget as it is to businesses and home budget. And you did mention something earlier, and I know you have been an advocate of raising taxes in the past, but you mentioned something that stuck out to me, that you said that if there's, because of inflation and some other issues, other factors, that the county will be forced to maybe reallocate funds and potentially cutting services. So just so we're on the record, are you saying there will be no tax increases in your budgets?
I'm going to do exactly what the charter requires us to do, which is the way they describe it is you assess the needs, you assess the revenue, and you balance a budget, and you send a balanced budget to the county council, and then the county council works on that. I've never said in the past before the budget comes out what we're going to do on the budget, either on the revenue or the expense side, because there are so many factors that we're looking at. So no, I'm not saying that. I'm not saying anything about that.
Okay. Thank you, Mr. Chairman. And then Dr. K, real quick, some of us have been fielding, a lot of us, I'm sure, have been fielding a lot of calls, and, some of it on what Delegate Chisholm mentioned, but there are some confusion, I guess, with the definition of an outbreak in some of the schools. And I'm just curious, is there flexibility in what the health department can provide to the schools when there's an outbreak? And for instance, the guidance that's the AACPS has been receiving or been getting is that if you have 3 kids in one class or one pod test positive, the entire class has to quarantine, or they need to show proof of vaccination. And if they don't show proof of vaccination, then they're considered unvaccinated. So what is the rationale? I mean, if you have a class of 50 kids or 20 kids versus if you have a class of 10 kids, is that number flexible, or are you willing to be a little bit more flexible on those issues and work closer with AACPS? I know you work closely with them, but a one size fits all is not always the answer. So we can always, I was going to call you today anyway, but I figured since you're here, you can just provide us a little bit more information on the trigger points that the superintendent mentioned last week. And does it change with changing positivity rate as it goes lower?
So Delegate Saab, I appreciate the question. So our guidelines are Maryland Department of Health guidelines. We don't have separate guidelines in Anne Arundel County for how we define outbreaks. In fact, during this most recent Omicron surge, we've actually been a little bit more liberal with trying to figure out what's happening in any given classroom, in any given school, precisely because there are so many illnesses occurring. There's so many cases, and frankly, it's overwhelming our systems, these number of cases. So whether it's a classroom outbreak or school outbreak, all of those are actually discussed and decision made between our epidemiology department and the school system. So there is flexibility. We are constantly exercising judgment. I think that's a hallmark for our cooperation, but that also means that there's no bright line, right? And so we've gotten criticized for having a bright line criteria and also for having too much judgment into it. I'd be happy to discuss any particular case offline, but overall our goal is to keep kids in school, but make sure that spread is not occurring unchecked. And it's just always trying to manage that balance.
Final question goes to Delegate Bagnell.
Thank you, Mr. Chair. And thank you for this presentation, Dr. Kalyana and thank you for trying to balance public health with policies that minimize the impact of those pivots. But I did want to ask County Executive, we're very excited about the potential of the Crownsville site. And I'm hoping that we can actually have in a future delegation meeting a dedicated presentation so we can understand better the scope of this revitalization, the timeline, the measures that are in place to make sure that it continues forward, so that we can also, from our positions, be working on community buy-in, because I'm sure that the community will have a lot of questions, but also will be very excited about this prospect. And I just appreciate that the efforts to really make this a jewel in the crown of Anne Arundel County.
So noted, Vice Chair Bagnell. I read you loud and clear. So with that, I want to thank County Executive Pittman, Dr. Kalyana Raman, the rest of your team for coming before us and updating us on where you are at this juncture. And I do look forward to discussing, as Vice Chair Bagnell said, a little bit more about Crownsville, because I think it has a lot of potential. So with that, there are a couple administrative things that we need to take care of before we ask for a adjournment for today's meeting. So obviously a reminder that the dues are $55. And I know in the last meeting, we had asked for any suggestions as to how we might use those dues for the delegation this year. And I know the only thing that was on the table that was mentioned was the Anne Arundel County Food Bank making a donation to them similar to what we did last year. So with that, I'll ask, is there a motion from the body on that particular request? Delegate Bartlett.
Yes, Mr. Chair, so moved. I move to donate our dues to the Anne Arundel County Food Bank.
Second.
Second.
It's been moved and properly seconded. Is there any further discussion? Madam Secretary, take the roll.
Vice Chairman Bagnell,
Yes.
Delegate Barnes, Delegate Bartlett,
Yes.
Delegate Carey, Delegate Chang, Delegate Chisholm,
Yes.
Delegate Henson,
Yes.
Delegate Howard,
Yes.
Delegate Jones,
Yes.
Delegate Kipke, Delegate Lehman, Delegate Munoz,
Yes.
Delegate Pena Melnick, Delegate Saab,
Yes.
Chairman Rogers.
Yes.
Mr. Chairman, the vote is 9-0 and the motion passes.
Thank you, Madam Secretary. So just wanted to let everyone know that the invitations for subcommittee meetings have gone out. Please let Sienna know of any LBIs that did not appear in November so that they can be quickly scheduled in front of the delegation prior to the subcommittee meeting on 1 March, the 1st of March. And so with that, are there any other comments for the good of the order?
Mr. Chairman, just wanted to, if I can, real quick, commend you on running a tight meeting, keeping it under an hour, and limiting dialogue and question. Maybe perhaps you can give the Board of Ed some tips, and this way we would need House Bill 95.
Thank you for that comment, Delegate
Move to
Saab.
adjourn.
Is there a motion to adjourn?
Move to adjourn.
Is there a second?
Second.
It's been moved and properly seconded. The meeting is adjourned. Thank you, everyone, for your attendance.